So biliary disease. So biliary disease is where it's not really the bile that's a problem, it's the stones that are causing problems. The stones could be lodged in the ducts here. We could have a stone right here. We just came from pancreatitis. So you could have a gallstone pancreatitis happens because we had a stone blocking the outflow of pancreatic juices and the pancreas activated itself, right? So we have stones that are causing problems. They cause biliary pain or biliary colic at first, right? It usually has a colicky pain, which means it's gone, and then it's intense, then it goes away. It comes and goes, right? And it's usually associated with meals. It can radiate to the shoulder and such. You can have jaundice that develops. And there's a classic triad that tells you have biliary pain, right? It's called, what is it, Charcot's triad. And then you have like a pentad that will have for more severe disease when we have a stone that's blocking flow. And all of a sudden, all this flow has bacteria in it, and it progresses into the bloodstream. That's called an ascending cholangitis, right? Chole being, gallbladder related. Angitis, I always think, oh, maybe it's blood vessels. No, it has nothing to do with blood vessels. It's the inflammation here that's inflaming and then the sepsis is rising literally before your eyes into the bloodstream. Okay, so stones, right? The liver makes bile, and it also makes bilirubin, and all this stuff is then stored for later, right? It makes all this bile when it gets super concentrated, right? Like when fat loss, excessive fat loss can put you at risk for this, or also excessive obesity can put you at risk. When you're hyper concentrated with fats, your fats are going to start getting, they're going to start, what are you doing? I'm not doing anything. You want to make a stone? Yeah, I'll make a stone. So it's going to start making stones, and those stones, unfortunately, can cause problems, right? A gallstone is never normal, right? So stone, if you make it, that's cool, you made it, but it can start causing problems, especially when it starts leaving the gallbladder itself. It could get lodged right here, and then whenever you have a fatty meal, it's going to start, compressing, because that's what it does in response to CCK, right, cholecystokinin. When you have a fatty meal, you're going to have a gallbladder attack, right? It's going to start squeezing that gallbladder to eject all the biliary juices that it's supposed to do, right, and help you digest those fats. So that's the kind of overview of our bile stuff and what is happening with the biliary system. We have different stages of where the gallstone can be and can cause different problems along the way. So calculus is stone, right? So we have acute calculus cholecystitis. We have a stone in the gallbladder that's causing it to be inflamed. And we have cholelithiasis. That means we have a stone in the gallbladder. It's not causing problems just yet. It might cause some symptoms. And we have choledocholithiasis, doco meaning duct, right? So we have a stone lithiasis in the duct related to the gallbladder. And then we have ascending cholangitis, we said was good or bad in red ink. Was bad, right? And then we have what happens in the ICU sometimes is acalculus. There's no stone being formed. It's just lack of flow, like in a shock state, just like you have ischemic colitis, and pancreatitis gets worse with poor flow. Poor flow to the gallbladder can make it just pretty much die. So it's a dying gallbladder, and it can eventually become necrotic at that point. So biliary anatomy. So again, the gallbladder is just a storage zone for bile and bilirubin, and bile salts for that matter, right? So if the stone is in the gallbladder, we said that's cholelithiasis. So cholelithiasis right here is a stone that's in the gallbladder, but it's not really causing problems. It might cause some pain, right? Especially after like fatty meals and such, right? But really it's just outpatient management, and we're gonna make sure it doesn't get worse. They're definitely come in when they start getting this triad developing, right? When they get a fever, when they get jaundice, and they have that right upper quadrant pain, that's where we're going to seek out care. And we'll talk about more of these in more detail when zoomed in, of course, when we come up to the symptoms of gallbladder stuff. This is our overview here. So this is called cholecystitis. We have a stone that is blocking the duct, usually the cystic duct, which is the exit point of the gallbladder, and it's contracting against a blockage, right? And that's going to cause more pain than if there was no blockage, right? So we have all this bile being produced by the liver. It gets stored in there, and it's going to eventually, it can start building up pressure and start causing a lot of pain if we have a blockage in the way. And what was the purpose of the gallbladder in the first place? It's just to store stuff. It doesn't do anything else important besides store bile and bile salt, which has bile salts and bilirubin. Bilirubin being a waste product of RBC breakdown. So it has all this stuff in it, and it's going to eject it, the bile specifically, into the duodenum via these tracts here, and help emulsify fats, right? Fats otherwise are going to be super slippery, and they're going to escape the enzymes. The enzymes coming from where? The pancreas, right? Pancreatic enzyme being our lipase that's going to digest fats. It's going to break down fats for us, and it's going to allow us to absorb fats and our A, D, E, K vitamins and all the other good stuff, right? So we don't get steatorrhea. Okay, so moving on, we have cholelithiasis, right? We have a stone in the gallbladder that's interrupting outward flow. That's going to be cholecystitis. And then we have a stone that's in the duct itself, right? Was this in a duct? Yes, but it's in the proper, or it's really in the duct that's interrupting outflow, right? The common bile duct. Why is it called the common bile duct? Because the liver is ejecting through there, the gallbladder is ejecting through there, and the pancreas is ejecting through there. It's like a major interchange. It's like the 5 freeway with the 5 north and the 14, and then the 110 comes into it as well, right? Or it's the 170. Anyways, they're all going to come together into one big freeway system, and then you have a huge backup on the freeway, right? And of course, this is one of the more serious ones. So it's going to cause the same triad of symptoms of fever, right upper quadrant pain, jaundice and such. Why jaundice? Because bile, yes, it's going to help digest things or help us digest, but it's going to help us our lipase work better. But also when it starts building up into the bloodstream, because you can't eject it, it's going to make you turn yellow or icteric, right? Make you turn jaundiced. Okay, so we have this choledocholithiasis, and that puts us at risk for the pancreas getting activated, getting us to develop acute pancreatitis. Okay, so that's a possibility as well, and that's why it's a high-risk situation. So we got to do an ultrasound to make sure that the common bile duct is not getting dilated, because if it's getting dilated, then that means that the stone is there obstructing the pathway, right? And only certain stones can be seen on that are radiopaque, I should say. And unfortunately, the most common stone are fat-laden stones are not radiopaque, right? But they can be, they can resist sonography a little bit, or ultrasound, I said, can pick it up just a little bit, but definitely we can see that the duct is dilated. Okay, so choledocholithiasis. So that's danger zone. And then once we have the stone being blocked there, all this backup of junk can back up in the liver, back up through the liver, and cause a sepsis process. And that's called ascending cholangitis. And that is, we're going to add the triad. We're going to open up the triad and form a pentad. It still has a right upper quadrant pain, it has fever, it has jaundice, but now that we have a sepsis brewing. And what do you have in sepsis? You have one of the other sides of this is altered, one of the other sides of this is shock or hypotension, right? Which makes sense. Ascending cholangitis is the worst case scenario. That's a sepsis process from all these other fancy ways to describe where the stone is along the way. Okay, so again, what does bile do? Bile emulsifies the fat so that lipase can work. If you don't use it, if you don't have, lipase can be there, but if you don't have bile, it's just going to slip away, isn't it? Right?
Wasting your time. Forget about it. Go do something else. Yeah.
So acute cholecystitis. So now we have, our gallbladder is inflamed, right? Well, what puts you at risk for being inflamed? There's the 5 F's or 6 F's up here as well. Pharmacy is trying to be with the F game, right? So there'd be some pharmacological reasons why you might have a gallbladder situation. And interestingly, it's ceftriaxone we give to everybody. So it's really not great to give it with someone with gallbladder disease because it's going to cause biliary stasis and put you at risk for gallbladder dysfunction. Okay, so it's just something to consider when your total bilirubin is high. Probably not to give ceftriaxone because it's going to cause biliary stasis, put you at risk for super concentration of stuff, right? And 80% of our stones are cholesterol based. We do have other options out there that we can make, but you can see here the stone is blocking the passageway of bile, right? If it's just outside the or at the entrance of the gallbladder, when you have a fatty meal, it's going to try to contract, and it's going to contract against a really hard surface here, or hard stone, and that's going to cause some biliary colic or some biliary pain, right? And biliary pain is located where? Left, right, lower? Where's it at? right upper quadrant, right? This is right upper quadrant pain, right on that side, is going to cause a lot of discomfort. And as that bile can't get through, it's going to start causing the bile to back up all the way and cause not so much like sepsis, but it's going to cause a rise in my T-bili, my total bilirubin, and I'm going to get some jaundice activity, all right, some jaundice situation. Okay, so what else? So we have acute cholecystitis, that's gallbladder inflammation because I have a stone that's blocking the passageway, or again, ascending cholangitis is where the bacteria has risen. Is my T-bili going to be high in both those situations? Yes. All right, the bilirubin is not be able to get out, therefore it's going to rise in the bloodstream. All right, we can't eject it. We have a biliary problem of some sort. Okay, so they have this jaundice appearance. And then ascending cholangitis is at highest risk when it's blocking the common bile duct, right? The common bile duct being right there. Right, we have a stone right there in the common bile duct between the pancreatic duct, cystic duct, and hepatic duct. That's going to put you at high risk for decompensation or ascending cholangitis. So you can see these stones are pretty impressive. It looks like dog food, right? So they got a lot of huge stones that are there. In this case, they did a cholecystectomy. They did a CCY cholecystectomy to take out that gallbladder. And inside that gallbladder, they definitely had some cholecystitis, right? They definitely had some gallbladder pain because they weren't getting anything past that bad boy right there, right? That's going to cause a lot of discomfort. Even if you just contracted on the stone itself, that's a cause of discomfort, right? So there are definitely similar causes, similar imaging, and antibiotics. The only time you wouldn't do antibiotics is if you didn't have a full plant, you don't have all the different ingredients, the labs or something like that, or they really just had this discomfort now and again. But once they start having fever, they start having that right upper quadrant pain and jaundice, that's really putting you to consider that they probably need antibiotics at this point. So unlike pancreatitis, which has like a little big asterisk on it, gallbladder stuff, you are going to give antibiotics early. Okay, we talked about acute pancreatitis as well already. Cholestasis and ascending cholangitis is our number one complication we're always worried about with anybody that has a gallbladder situation, right? Remember, the gallbladder is just trying to make stones, and unfortunately does that when it's hyper concentrated.
Hey, Gallbladder, there you are. We got a cheeseburger coming in. You got any more bile? Hey, listen here, duo. I know you like the bile, but, I got something else I'm making for you. What do you mean, you got something else besides bile? Hey, come over here. You like stones? What am I supposed to do with that? You can't even get it to me. It's too big. Don't even worry about that, okay? You're gonna love these.
Hey, what are you two doing?
Get out of here, liver. This doesn't concern you.
I thought I told you no more stones.
Ain't doing nothing wrong over here.
I gave you that bile. You gave me sludge.
So our symptoms of biliary pain or biliary obstruction, right? So biliary obstruction can lead to, well, why would you have these symptoms, right? You can have symptoms from a stone in the way, or you can have an inflammation of the gallbladder itself. And then here in red, that's when we're going to start introducing the shock state from the sepsis that is ascending, all the way from the Choledocholithiasis. It's ascending all the way up through the bloodstream, right? Going right here through the portal circulation, right? Or sorry, the hepatic vein. Yeah, it's a portal vein as well, sorry. Or back it up here. I'm thinking liver too soon. Here's our bile right there, right? Going right up that biliary duct. And look, it only has to go like millimeters to hit the central vein. And what's next is the heart, the right atrium, right? I changed colors, I promise. There we go, right? So the heart is right there. So we have an easy pathway of sepsis all the way right here that can circulate through the whole bloodstream. And at that point, now we have a full-on sepsis process with ascending cholangitis, right? So that's our worst case scenario. So going back to the beginning, if you just have like Cholelithiasis, just a stone in there, it might just be asymptomatic. You might not have any symptoms, maybe some vague symptoms. You might, if they're older and diabetic, definitely have more vague symptoms. But when they start occluding the outflow tracts of the stone gets produced and it starts getting blocked right there. We got a stone right here in the cystic duct or right at the entrance of the gallbladder, right? That's going to start causing some biliary colic, and that has that pain that is, it's there and then it's definitely there after a meal, right? So after a meal is definitely a biliary colic, right? And this, you're not going to be able to get rid of bile efficiently, and this is going to start to not be released as well, and you're going to have a buildup of bile in the bloodstream. And you can measure that with a total bilirubin, We can measure how much bile is there. And if your bilirubin starts getting more than 2.5 points, you're going to start getting jaundice. So there's the colicky pain there. And then we have jaundice down here due to buildup of bile. And this is not normal. This is a lot of pain. So you could get the SNS firing off. It is like a precursor to infection as well. And it can definitely cause a fever and a white count elevation. So we got SNS response, we got right upper quadrant pain, we have a T biliary that's going up, we got this classic biliary pain that's associated with meals. This is all kind of adding up to this triad of fever, jaundice, and right upper quadrant pain. When you have those three things, it's like it's gallbladder almost 100% to prove it otherwise, right? There are some other rare reasons it might be, but this is what we're suspecting, like number one, okay? It's called Charcot's triad, all right? So it's your, they could also like 3 C's. Another way to think about it, you got chills, right, like fever, you got colicky pain, and you got color. So you got right upper quadrant pain, the jaundice, and the fever happening, right? And that right upper quadrant pain, it's going to be what's called an inspiratory arrest. So as you touch the liver, right, and they exhale, your liver goes down or up when you inhale. Liver goes down when you inhale, and then they're gonna well, that hurts, right? Because you're filling right here, and that's gonna cause a lot of pain when that gallbladder is inflamed, right? And Murphy's sign, you can't just do that with the laying in the bed. The proper way to do a Murphy's sign is to go up behind them and say, "Hey, I'm Murphy," and you're going to put one hand over, and you're going to reach around, and you're going to say, "Okay, inhale for me," and you inhale, and that's how you get a proper Murphy sign. It's in all the Bates assessment books and everything. That's how you properly do it, right? But obviously, if they have pain just with you assessing with them supine, is going to also cause that could also be valid as well. So right upper quadrant pain. Okay, and also you get this pain also with ultrasound. So when the ultrasound tech goes in there, this is the gallbladder. It's like, hey, I got a lot of pain when I was doing the ultrasound. That you get it right here in the right upper quadrant. That's called a sonographic Murphy sign. Okay. All right, then what else? We got Charcot's triad, and that can develop into Raynaud's pentad. So it's just the 3 arms of the triad, and we're just going to add 2 more limbs to it, right? So now you get a geometry lesson, right? So you got a pentad happening right here, a pentagram, and we're adding on shock stuff because what happened is all this business right here, the gallbladder is produced this stone, and now the stone is blocking outflow, and we're going to have an ascending cholangitis on our hands. We have the fever, right upper quadrant pain, and jaundice, and we're going to add on 2 more things because now we have this widespread infection. Your body's going to react like, what the heck is all this bacteria they just introduced in my bloodstream, and they're going to have a surge response, right? They're going to have hypotension added with it, and also surge response, especially in elderly, is going to make you confused. So the other 2 pieces are being confused and having low blood pressure, right? So a shock state and being a, what else do I have? A confusion. Those things are going to put us at risk for, or let us know that we probably have Charcot's triad, which is what? Assessment of ascending cholangitis, right? And that's a worst case scenario. That's where we don't want to happen. We want to catch it before that happens. Okay. They did a lot of diagnostic tests as well to see like what it tells you actually have gallbladder stuff, and basically this triad and pentad, check out. Those tell you that you have a patient that has gallbladder situation if you have these assessment findings. And of course we could do imaging findings, we can do an ultrasound, and they found out that CT scans were not as great as ultrasounds, because CT scans like, well, that's perfect, that's better than x-ray, right? And do CT scans, get all these slices, but it's not as good as a plain old ultrasound.